Thank you very much, Senator Cassidy. Dr. Herbert, I do want to follow up with you on the issue of the shortage of nursing faculty. It just is astonishing to me that I guess it was in 2021, almost 92,000 applications for baccalaureate and graduate nursing programs were turned away, with faculty shortages cited as the top reason. And the University of Maine this year had 1,239 applications for only 80 slots. So I think there's this misperception that people don't want to become nurses, when in fact, we have a ton of applicants from people who do want to enter the field of nursing, but we don't have the professors to teach them. And that's why the chairman and I and the ranking member have been working hard to come up with a solution. I want to probe more with you on how we bridge the faculty gap. You mentioned in your testimony, Dr. Herbert, that in some cases, practicing clinicians can be recruited to serve as faculty instructors in their existing workplaces. Could you give the committee an example of how UNE is working with an academic institution or a hospital to expand training capacity?
So thank you very much, Senator Collins. We're doing exactly that. First of all, I agree with everything you said. It is a real problem. And you're also right that there's a lot of demand out there for people who want to become nurses and other healthcare professionals, and but with limitations in what we can do. At UNE, we have increased the number of nurses we train 300% in the past 10 years, so we're continuously looking how we can expand that. A program along the lines that you're describing is something we are doing in partnership with Maine Health. Maine Health is Maine's largest healthcare network of providers, and also also has branches in New Hampshire as well, southern New Hampshire. What we're doing is we're actually using the faculty on site, using nurses on site. We provide professional development and support from the university to have them train people on site in the Maine Health hospital system. So using clinicians, this is part of that laddering approach. So we're also training the nurses, upskilling the nurses, going from LPNs to RNs, RNs to BSNs, BSNs to nurse practitioners on site in partnership with Maine Health. And we're looking to expand that program with other healthcare programs as well. So trying to find creative ways of addressing the faculty shortage.
Thank you. Dr. Steger, I saw you nodding. Did you have something to add?
I was just going to say, there's been such strong growth in the number of people going through nursing schools. Applicants have outpaced that, so that's why they're, but the thing, and so we shouldn't be surprised there are faculty shortages. It's been chronic because we've tripled the number of students going through nursing programs in the last 25 years. Nobody thought that could happen 25 years ago. It's been heroic what the nursing schools have done, and it is. It's a chronic problem. I also think it's a problem that the nursing schools have been able to solve with help, and I'm optimistic going ahead.
So we've still got this huge gap. Dr. Hildreth, I was very moved by your testimony, and I was reminded of the fact that one reason UNE has been so successful in getting its graduates to practice in rural areas is they do the third-year program in rural areas. So do you do something similar to that in order to encourage people to return to underserved areas?
Thank you, Senator Collins. I mentioned earlier that we're really happy that the governor of Tennessee, Governor Lee, and the leadership helped us create a program where we recruit students from rural areas to come to university there, and they're admitted into medical school at the same time. It's an accelerated program in which their tuition is paid both undergraduate and medical school, and they've committed to go back and work in the communities they come from. And I think that's a model that should be repeated all over the country. Thank you.
Thank you.